President William Ruto maintains that the Social Health Insurance Fund deduction will be 2.75% of gross salary, as earlier indicated, effectively overruling a proposed 5,000 shilling cap that had been announced by Health Cabinet Secretary Susan Nakhumicha. The President has hailed the new Social Health Insurance Fund as an equalizer for all Kenyans seeking healthcare in the journey towards universal health coverage. He says the fund, which is set to replace the National Health Insurance Fund, that is NHIF, signifies a shift to increased use of domestic resources for health financing and a sustainable approach. Stephen Leto reports.
According to President William Ruto, statistics indicated low health insurance coverage in Kenya at an approximate of 26%, with those at the bottom of the economic pyramid having the least coverage of less than 5%. The President today saying the move to bring into force the new Social Health Insurance Fund will bring medical equity across the country.
Kila mtu alipe 2.75%. Lakini tuko tayari kusikiza maoni ya Wakenya. Tunataka Wakenya watuambie hapana, nani alipe kiasi gani. Kwa sababu nia yetu, vile niliwaeleza, wale wanalipa shilingi 500 saa hii kwa NHIF na mapato yao ni chini ya shilingi 10,000 kila mwezi.
During the big conversation on Citizen Television on the 13th of September, Health Cabinet Secretary Susan Nakhumicha had said the 2.75% gross salary deduction will be capped at 5,000 shillings. The President's stance illustrating the latest instance of contradictory messaging by government.
But I also want to clarify. I have seen people saying that, so that means somebody will pay 100,000 plus. No. We have a cap of 5,000 shillings. The minimum is going to be 300, and those who cannot pay, then through the means testing as determined by government, will get subsidy. Government will be able to pay for them.
According to the President, Kenyans who run the small and medium enterprises will also be accommodated in the plan and will pay lower than the previous NHIF rates.
Tunataka tuwapunguzie kutoka 500 mpaka shilingi 300. Na mimi na hawa wadosi wengine ambaye mshahara yetu iko juu kidogo, si ndio? Sisi pia tulipe sawasawa na wale wa huko chini, tulipe pia 2.75%.
He says the Ministry of Health will further engage Kenyans on the rollout of the new fund.
Kuanzia wiki ijayo tutakuwa na mjadala Kenya ya vile tutalipia gharama ya bima ya afya. Mapendekezo yetu ni kwamba tuweke usawa.
Widespread opposition to the Finance Act during the public participation stage did not deter the Kenya Kwanza administration from imposing the particularly contentious housing tax. There are several court cases ongoing against the tax. The President says that the 4 healthcare laws will ensure healthcare access will no longer be determined by financial capacity, but rather by the healthcare requirements of every Kenyan. Stephen Leto, Citizen TV.